Breast cancer is the number one cancer in women in the world, but also in Namibia. And it is abnormal growth of cells that form in the breast. It's one of the many different types of of cancer, but an abnormal growth forms in the breast, and there's usually risk factors that are attached to the development of breast cancer. And it manifests then as either a lump in the breast, or you can just have a very swollen red breast, or it will show a nipple discharge or nipple retraction or a swelling under the armpit. So it can manifest in many different ways, but the most common manifestation of a cancer in the breast is a lump. Not all lumps in the breast are malignant. They can also be benign or not malignant, not cancerous. And for that reason, every breast lump needs to be imaged with a sonar or a mammogram, and then it needs to be biopsied. So it needs a needle biopsy to tell us whether it's a cancer or not a cancer. So risk factors. In less than 10% of cases, there's a positive family history. It's an inherited disease. And more than 90% is a random disease. And the risk factors are obesity and lack of exercise and smoking and alcohol. Another risk factor can be the prolonged use of hormones, although that's a minor risk factor. Then old age is a very important risk factor. Older women get breast cancer much easier than younger women, although we do see very young women. Years ago it was always older women, but now we also see 20, 30 and 40-year-old women with breast cancer. And of course men can also get breast cancer. The treatment of all cancers usually is prevention, early detection, then the medical treatment, and then palliative and supportive care. So what we can do in order to try and prevent breast cancer is, if you have a positive family history and you might have a inherited genetic predisposition, then I think it's important to start going to the doctors very, very early on. You might go for genetic counseling, and there's various ways and means that the doctors can suggest how to deal with it. But in most cases, it's just one of the lifestyle cancers, and you have to address your lifestyle factors. So prevent obesity, do not become overweight, do regular exercise, no smoking at all, limit alcohol to 1 drink per day and never more than that. Have a very healthy, balanced diet, low sugar, low fat, lots of vegetables and fruit and salads, and medium protein, and exercise. In order to early detect breast cancer, we can do self-examination, and then we can go for screening. So self-examination is where every teenager, young woman, older woman do a breast examination once a month, and usually after menstruation. That's the best time, when the breast is soft. And that is basically just palpating your own breast. First look in the mirror, look for any changes, and then self-examine your breast and feel your breasts, both breasts, and make sure that you know your breast, so that you can detect any difference very quickly and then go and have it checked out. And then if you feel something, then you'll go to a doctor or a nurse, and they will do a clinical examination, which is a little bit more objective and with medical knowledge. And screening is very important to early detect breast cancers. So breast cancer is treatable and curable if we catch it early in stage 1 and 2. And then to detect a breast cancer in stage 1, we need to do screening. So all women over the age of 40 should have an annual mammogram and a sonar, and that will detect a really small breast cancer, where your chance of survival will be more than 90%. So that is really the ideal. So over the age of 40, once a year, mammogram and ultrasound, sonar. And if you have a very strong family history, it's a good idea to go younger, to start with those examinations much younger. So I think it's very important that all women need to go when they feel something abnormal, then they need to go and get help. So if it's a state patient, they should go to the nearest clinic or hospital or to the Cancer Association, and private patients should go to their GP, to their doctor immediately. And they will then arrange for imaging, for mammogram, ultrasound, and then they will have to do a biopsy, which is usually a needle biopsy, to determine if it is cancer and what type of breast cancer it is, because there's many different types. And then the patient will then be seen by a team of doctors who will then decide on what kind of treatment and sequence of treatment.